The Bono region has recorded confirmed cases of yellow fever in 3 districts with 1 death. Dr. Prince Kwashi, the Deputy Director, Public Health at the Regional Directorate of the Ghana Health Service, has said. 3 of the cases were reported in the Wenchi municipality, as well as 1 each in Tyne and Banda districts of the region. The Ghana Health Service has notified the public about an outbreak of yellow fever in some districts in the Savannah region, with 8 deaths reported. The outbreak was confirmed after initial laboratory tests were conducted by the Noguchi Memorial Institute for Medical Research and the National Public Health Reference Laboratory. The outbreak of yellow fever, initially detected in the Savannah region, has now spread to the Wa East district in the Upper West region and claiming 25 lives across the country. Dr. Kwashi said 2 of the cases, including the dead, a Fulani nomad, were referred from Tinga in the Bole district of the Savannah region to the Wenchi Government Hospital.
So if you are talking about Bono region, the cases that we have recorded, which belongs to us, are the 1 case from Tyne district, the 1 case from Banda district. And out of the 5, we have lost 1. And that one was one of the referrals from Bole. So we have 4 who are alive, and then they are doing well. Well, immediately we had the information from national level that we have had 3 probable cases of yellow fever. We started working. So the district health directorate activated what we call the rapid response team. So what they did was first to go to the hospital to really confirm the cases, and then also alert all the health facilities in the district to be on the alert because there's a likely yellow fever outbreak in the district.
Dr. Kwashi explained that the Directorate had intensified surveillance, public sensitization and awareness creation, and appealed to particularly the populace in the 5 districts to report to the nearest health facilities whenever they experienced abnormal headache, general body pains and weaknesses.
The few, maybe about 15% of the population, who have never had yellow fever vaccination, those are the people that we are worrying about, because those are the people that when they are bitten by the infected mosquito, they can have the yellow fever infection. And then the yellow fever disease has no definitive treatment. So when you get the disease, what we do for you is supportive treatment. So the death rate can be very high. It can be very high, as it is happening in the Savannah region. So that is why it is very important that if you haven't had the yellow fever vaccination at all, if you are an adult in Bono, then you have to get to the nearest health facility and then have the yellow fever vaccination.
Meanwhile, the Central region is on high alert following the outbreak of yellow fever in parts of the country. The Regional Directorate of the Ghana Health Service has alerted. Consequently, it has intensified surveillance on all nomads known to have been the lead agents for the spread of the deadly disease in parts of the country. Dr. Akufo-Addo, Regional Director of the Ghana Health Service, disclosed this at the Regional Coordinating Council meeting in Cape Coast. According to Dr. Akufo-Addo, nomads have proven difficult to be vaccinated due to their movements from place to place to find fresh pasture for their animals. All district directors have been tasked to track the nomads in their areas of jurisdiction for prompt vaccination to avoid an outbreak in the region. According to the World Health Organization, yellow fever is an acute viral internal bleeding disease transmitted by infected mosquitoes. Symptoms of yellow fever include fever, headache, jaundice, muscle pain, nausea, vomiting, and fatigue. A small proportion of patients who contract the virus develop severe symptoms, and approximately half of those die within 7 to 10 days. Large epidemics of yellow fever occur when infected people introduce the virus into heavily populated areas with high mosquito density and where most people have little or no immunity due to the lack of vaccinations. In these conditions, infected mosquitoes of the Aedes aegypti species transmit the virus from person to person. The disease is prevented by an extremely effective vaccine, which is safe and affordable. A single dose of yellow fever vaccine is sufficient to grant sustained immunity and lifelong protection against the yellow fever disease.